Hello, my name is Lisa Strickland, and I'm going to talk to you about electric shock therapy, which is known as electric convulsive therapy, ECT. In 1934, Dr. Ladisla Maduna was the first doctor to use this therapy on humans. Dr. Maduna observed brain sections from patients that had epilepsy and compared them with the brain sections of patients that had schizophrenia. He theorized that seizures could be used to treat psychiatric disease. And during these times, the psychiatric hospitals were overwhelmed with patients that were suffering from a lot of schizophrenia and bipolar issues, so they really needed to come up with something to help these patients. He theorized that seizures could be used to help these type of psychiatric diseases. So Dr. Maduna used his methods on patients in his hospital. His technique was effective, but it was inefficient. That's when a team of Italian physicians stepped in to help him. So there were two other doctors that decided to join him and help him come up with a better method for electric convulsive therapy for patients. That was, one of the gentlemen was Ugo Cerletti. He was a neurologist and a psychologist. And also a psychologist, Lucio Bini, jumped in to help this doctor. They had a few ideas for a quicker method with fewer side effects. Unfortunately, they didn't want to try it on humans, so they used dogs as test animals, and they would put electrodes in the dog's mouth and the dog's anus to test and see what the effects would be. After refining the procedure, they were ready to test on humans. They did find a gentleman that had been wandering a train station for a long time that exhibited behavior of schizophrenia and memory loss, and they were able to try this new method on this gentleman and help him regain his memory so he could eventually return back home. Because of the way these two doctors came and helped change electric convulsive therapy, this is how and why we use it today. It is, like I said before, it's most commonly used for people that suffer from severe depression and bipolar disorder and have not responded to any other type of medical treatment. ECT is applied by placing electrodes on patient's scalp, and a finely controlled electronic current is applied to the patient under general anesthesia. So the patient is put under general anesthesia when this is applied. They receive 110 volts for 0.2 seconds, and it is applied, which causes a brief seizure in the brain. Now, the first time I witnessed this was in a movie, One That Flew Over the Cuckoo's Nest with Jack Nicholson. And it really affected me. It really made me think, is this the way we really treat our patients in psychiatric hospital? And I thought about it for years. I saw it when I was a young girl, and it always stuck in my mind. So when I had a chance to research it, this was the first thing that came to mind. But actually, One That Flew Over the Cuckoo's Nest was not the first movie to showcase electric convulsive therapy. In 1948, there was a movie called The Snake Pit about a young lady in a psychiatric hospital. And I'm going to show you a brief clip on how she received her electric shock therapy.
Lie down on this table. How are you today, Mr. Cunningham? You're going to electrocute me. But my time's so great.
No, Mr. Cunningham, nobody's being electrocuted. Dr. Summer and I are just trying to make you well. We're your friends. Oh, that's it.
Mary, get on this side. Give it up. Now just relax, honey. Now what?
Davis, I want to have Lucy. Just right around the neck.
Yes, sir.
Don't be afraid.
Okay, so that was a small video clip of the movie The Snake Pit that was filmed in 1948. And once again, that was the world's first peek at electroconvulsive therapy. The next clip I am going to show you is from the movie One That Flew Over the Cuckoo's Nest, starring Jack Nicholson. This movie was made in the 70s. It's a very popular movie. It is about a gentleman that goes to a psychiatric hospital to be evaluated. Jack Nicholson stated he did not realize the effect that this movie would have on the world as far as treatment for psychiatric patients. The world took another whole look at how we treated patients and how electroconvulsive therapy was distributed. So here's a clip.
This won't hurt. It'll be over in just a moment. Uh-huh. What's that?
Conductor.
Oh, dabble, do you? All right, Mr. Jackson.
Open your mouth.
What's that?
This will keep you from biting your tongue.
Well,
Now just bite down on it.
oh.
That's right. Just bite down.
Huh?
Now bite down on it.
Are you ready? Here we go.
After the film was released, the American public thought that electroconvulsive therapy was brutal, harmful, and abusive. So we made many strides to improve on electroconvulsive therapy. Nowadays, we have other treatments that include medication, talking therapy, arts and creative therapy. I'm going to show you a couple clips of how we use electroconvulsive therapy today. You will definitely see a change and an improvement. So here are the clips. With the advances in medicine, ECT is rarely used these days. Once again, we have a lot of different therapies that we can use to help people with their schizophrenia, bipolar, depression, and any other mental issues that they have. There's a big difference in therapy from the movie One That Flew Over the Cuckoo's Nest that was filmed in 1975 to the way that electroconvulsive therapy is administered today. There have been a lot of improvements, and I'm very happy. This did ease my mind as far as the usage of electroconvulsive therapy, because in the movie One That Flew Over the Cuckoo's Nest that was filmed in 1975, it was used more as a method to control the patients, and it was very abused in that movie. So in the end, I did get to learn a lot about electroconvulsive therapy, where it came from, how it was used, and how we use it today. So I am glad I had a chance to share this knowledge with everyone. Thank you for listening, and have a great day.